following segment may contain sponsored content paid for by advertisers. The opinions and views expressed belong to their sponsors and not those of Nexstar Broadcasting Incorporated, this station, or their affiliates or employees. You're watching Central Illinois Newsday.
This time of year typically marks a major transition for young adults as many prepare to return to high school, college, or leave home for the first time. For many, COVID-19 has complicated matters. It's even more challenging for students battling sickle cell disease, a devastating and lifelong inherited blood disorder that disproportionately impacts African Americans and Hispanics. Here to help young adults as they learn how to take on more responsibility for managing their health, especially during the ongoing pandemic, are Dr. Wanda Witten-Shurney and a pediatric hematologist-oncologist at Children's Hospital of Michigan, along with Casey Morse, a teacher who lives with sickle cell disease. So let's jump right in. Dr. Shurney, we'll start with you. As students begin their new school year, what are some concerns for those with SCD, especially amid the pandemic?
In terms of our concerns and our challenges, you know, when you move from adolescence to adulthood, then that's transition, and that's always challenging for everybody. And then you add a chronic illness to that, and that's another layer of challenge. And then you add COVID-19, and that's even another problem. And so there's layer upon layer of concerns, you know, so you're going to a new environment, you're losing that warmth and support of your pediatric hospital and having to find new health care and take control of your own health care. And individuals living with sickle cell disease are more susceptible to COVID-19. So all of the precautions, the mask wearing, the hand washing, don't touch your face, and especially the social distancing are so important and so difficult because, you know, there's so many distractions when you go away to school. You're trying to have a good time, you're trying to keep your grades up, and then you have to, once again, take care of your health and protect yourself from this pandemic. So quite challenging.
And Casey, just a few years ago, you went through the transition from high school to college. Can you tell us a little bit about your experience?
I was very fortunate to have a great pediatric team who transitioned me to an adult healthcare team that I absolutely loved. But just like Dr. Shurney was saying, when I arrived on campus, I was so excited about, you know, joining clubs and being in a sorority and doing shows and being active that I kind of lost track of taking care of myself and my health as it pertains to sickle cell disease. And I was finding myself really sick and in hospitals, and it took me refocusing in on my communication with my doctor, as well as my support system of friends and family, to figure out, okay, I really need to focus on my health.
Dr. Shurney, what advice do you have for high schoolers and college students who are now assuming more responsibility for their health?
Well, the most important advice, of course, is to know your disease and to have a plan and to make sure you continue to take all of your medications. And one of the things that we're doing is partnering with Global Blood Therapeutics, not only to raise sickle cell awareness, which is so important, but also to talk about a medication, Oxbryta, which is the first FDA-approved medication that actually targets sickle cell disease at its core, which is that sickle red blood cell. So you can imagine if we can stop that red blood cell from sickling, then we can definitely improve the quality of life of individuals living with sickle cell disease.
And Casey, for you, what are some important tips for SCD students to keep in mind?
Just, you know, for students out there that are either in this transition period or not in a transition period but going back to school, making sure that you stay hydrated, stay rested, stay focused on yourself, and make sure you have a good support system around you on those good days.
Well, thank you both for joining us here on CI Newsday. We appreciate your insight and awareness with sickle cell disease. For more interviews and for more information on SCD, visit our website, ciproud.com. Until then, CI Newsday continues after this.